Gaga.
So let's say there are expectant parents and first-time parents. How should they actually pick a pediatrician? What should you look for?
Well, what I usually recommend is that they ask their friends and family members first to get a list of a few doctors in the area, and then they can start narrowing it down according to location and who's on the insurance and things like that. And I'll usually tell parents that they should go interview the doctor. Most pediatricians, they do a prenatal visit or a meet and greet where you can come and just kind of see their office and meet the doctor and ask them their questions and their philosophy regarding different aspects of medicine. So, and I usually recommend doing this about 2 or 3 months prior to delivery. So in the third trimester, typically.
Okay, wonderful. Confusing umbilical cord care that we have to take care of. So can you shed some light on that for us?
Well, as far as the umbilical cord, there's actually not very much to do about the umbilical cord.
It just looks scary.
Yes, it does look kind of scary, and sometimes in some hospitals they'll dye it blue, so it can look a little unusual. But actually, you're just going to leave it alone. It falls off usually in about a week or two.
Okay.
In the past, some hospitals would ask you to clean it with alcohol, but we don't always do that because we found out sometimes that delays the cord falling off. Okay. So you just have to leave it alone. The main thing is we ask that the babies not take a bath, like where they're fully submerged in water, until the cord is off completely. Okay. But there's really nothing you need to do about it. You may want to just keep an eye on it to make sure there's no signs of an infection, which would be redness or pus or anything like that around the cord. If you saw anything like that, you'd have to go see your doctor. But if it looks normal, then it kind of dries up and falls off on its own within a couple of weeks.
Okay, good to know. When the baby is born, you have to give the baby a taste of honey. Yes. Now here you get scared witless by the physicians who tell you, honey, botulism, no honey. What do you do? Honey or not to honey?
No honey.
No honey.
No honey. No honey until about a year of age. Okay. And, I love honey. Like I said, like you mentioned, the name of our practice is Honey Pediatrics. But we don't like to give it in kids less than a year. And the reason for that is because of a risk of a bacterial infection. Botulism, as you mentioned. It increases the risk. It's not like a guarantee if you give honey to a baby that they're going to get it, but it increases the risk because babies are more susceptible to it than adults are or older kids are. So because of the increased risk, we just don't give it to any babies less than a year.
Okay, so no honey. Parents, I hope you heard that. All right. The baby has to undergo all these different screening tests, right? Of course, there's the hearing test and a whole battery of tests.
So the hearing test is done prior to discharge, and that's it just to make sure that the baby can hear. Because if there is a hearing problem, that's something you want to detect early. There's a couple of methods to do that. One's called the ABR. The other is called OAE, and basically both of them are they play a sound in the baby's ear, and one of them. They put electrodes on a baby's head and see how the brain activity, how it responds to the sounds. And that's how they check the hearing at that age. Okay. So that's one test. There's another test called the newborn screen, which if you've had a baby, you probably remember them poking your baby's foot in the hospital. So that basically is just a screening for some congenital diseases like sickle cell disease and some like metabolic disorders, cystic fibrosis. There's a whole battery of things that they check for. And those are basically things that the state wants to be checked because if the baby has it, then you want to detect it early because they can be life-threatening. Some of them can be life-threatening if they go undetected. But if you catch it early, then you're able to treat it.
And one very common problem seems to be jaundice, like this, what is it, second day or third day?
It can happen as early as the first day, which happens when it's severe, but usually it peaks about day 3 or 4. That's one of the main things that we're looking for in the hospital. A lot of babies are jaundice. Some say even up to like 40 to 50% of babies can get some degree of jaundice. It's only concerning if it gets to the point where it's high enough where you have to do phototherapy. And you've probably seen that in the hospital where they put the baby under lights and they help to bring that level down. So jaundice is a common problem. A lot of times the peak of it, though, is after you leave the hospital. It's usually like day 4 or 5. Right. So that's why it's important to see your pediatrician within a couple of days of discharge. That's one of the things we're checking. We're usually checking the weight And the second thing is we're usually making sure there's not the jaundice level, or we check something called a bilirubin level is not too high.
Okay, wonderful.
The reason why babies get jaundice is there's a substance in the blood called bilirubin, and this is it comes from red blood cells, and usually your liver processes that and you excrete it. But in babies, because their livers are immature and they're not working working as efficiently as an adult, then sometimes this can accumulate in the blood, and that's when enough of it accumulates, they start having that yellow color to them, the yellow skin tone. As far as the mother's diet, if you're breastfeeding, then you want to make sure that she's, eating healthy and drinking plenty of fluids, and that will help her milk production, which in turn will help the jaundice. But as far as a direct result on the bilirubin levels or jaundice levels, then the mom's diet is not going to make have a direct result on that.
And of course, then you have to select a name for the baby, which sometimes is a real issue of contention between the parents and the families. But I understand you're not allowed to leave the hospital without a name for the baby.
I've never come across a situation where a parent tried to leave the hospital without naming the baby. But when I go see the parents in the morning after I've seen the baby, I'll ask them what the name is. A lot of times they'll say, I haven't decided yet.
Right.
So I think they like to take their time to decide on the names, which is fine.
Right.
But I've never had a situation where they haven't had that. So I haven't really come across that where we haven't had where we had to not let them leave the hospital.
A nameless baby.
Yeah, a nameless baby, exactly.
Right. And my brother, who's a pediatric dentist, had a patient once, and the name was Female Brown. And he asked the mother, where did you come up with the name? And she said, well, I didn't choose the name. The hospital chose the name for my baby. Female Brown. True story. Okay. So now you're home and there are no nurses around to explain this little baby to you. And you're trying to figure out the cries, right? And the child eternally seems to be forever hungry. So a couple of questions about the feeding patterns. Formula, yes or no? Breastfeeding, exclusive or no? And how do you know whether the child is getting enough milk?
So the optimal nutrition for a newborn is breast milk. So if you're able to breastfeed, then we recommend breastfeeding exclusively for the first 6 months of life. If you're not able to do that, then formula is adequate nutrition but doesn't have some of the other benefits that breast milk does, which we can get into some of that later. But either one is enough to help the baby grow. If you're breastfeeding, you want to keep an eye on the wet diapers.
Okay.
And that kind of gives you an idea of if the baby is getting enough.
So how many wet diapers?
So generally in the first couple of days, the baby will make maybe 1 or 2 wet diapers. And by day 4, they'll be making a lot more, usually like 4 to 6 wet diapers. And so,
I thought it was more like, in my experience was 40 to 50. That's what it felt like.
It seems like that way sometimes. By the time they get to about a week old, then it's not unusual to see like 12 diapers in a day.
Okay.
But it slowly picks up with time. It takes a few days for mom's milk to come in, usually, if you're nursing. Usually the first milk is called colostrum, which is kind of a yellow, thin substance, which is very good for the baby, actually. It's full of white blood cells and things to help fight for infection. It actually is a laxative to help to pass the meconium in a baby. And then by day 3 or 4, the milk starts coming in. And then over about a week or so, they'll start getting the regular breast milk.
And do newborn babies, are they supposed to have a bowel movement after every feeding?
They don't have to have it after every feeding, although a lot of babies do. But as long as they're having like 3 or 4 stool diapers a day, then that's normal. Now these are just kind of ranges that are typically normal. Every baby's going to be a little bit different. But generally, it's going to be at least 3 or 4 stool diapers and at least 5 or 6 wet diapers a day. Okay.
We're talking about newborn baby diapers, the fun stuff. Now, color of the stool, does it make a difference?
It's usually going to be, in the beginning, it's going to be kind of black and tarry stools, and that's a meconium stool that the baby has initially in the first few days of life. After the first few days, it's going to look kind of seedy and green or yellow, and that's a normal appearance. the colors can change. Not everyone's going to look exactly the same.
Okay.
And once the baby starts solid foods, usually about between 4 and 6 months, then the color can change even more. But typically, it's going to be some sort of shade of yellow or green.
Yellow or green, delightful. Okay. Babies sleep a lot, right? Should we be waking up the child to feed them, and what's the optimal feeding schedule?
In the beginning, you should wake them up if they sleep more than 4 hours.
Okay.
And that, I'd say the first month or so. After that, then the longer they sleep, then you should consider yourself lucky if they sleep more than 4 hours.
Okay.
But in the beginning, because we're keeping a close eye on their weight, and we want to make sure they're getting enough fluids in, we recommend, if they happen to sleep more than 4 hours, to wake them up and feed them. But most kids at that age don't sleep more than 4 hours. Some of them may occasionally.
Okay.
But usually, the typical feeding schedule, most babies will eat every 2 to 3 hours. If they're breastfed, it can be a little bit even sooner than that, like maybe every 90 minutes. So somewhere between 2 to 3 hours is the average. Sometimes babies who are formula fed, they may stretch it out a little bit longer, maybe 3 hours or 4 hours or so.
So even at night, you should wake them up.
In that first month or so, the first few weeks of life,
Okay.
You should not let them go more than 4 hours without feeding. After that, you can let them sleep.
Okay.
Yeah, by the time they get to like 2 or 3 months, if they're sleeping 4 or 5, 6 hours, whatever, then you can let them sleep through the night.
Okay. Now, one thing I noticed was that in the hospital, sometimes the babies would be given a pacifier. And you hear it all the time, like if you want to establish successful breastfeeding, do not give the baby a bottle or a pacifier in the beginning. What are your thoughts on this?
So typically, we don't recommend, if you're trying to breastfeed, we don't recommend pacifiers in the first few weeks of life, like 3 or 4 weeks of life. They're fine after that, and there's actually been studies that have shown that it decreased the risk of SIDS, sudden infant death syndrome, by using a pacifier. But in the beginning, they can have some problems if they're learning how to breastfeed and trying to get their latch and get their schedule down if you introduce a pacifier or a bottle.
Okay.
So if you don't have to, we don't like to do that. A lot of hospitals don't do that. Some hospitals do, but a lot who are trying to encourage breastfeeding, then they won't give pacifiers in the beginning unless the parent specifically requests it.
Okay. And you said in the first month, it's important to, if you are breastfeeding your child, to exclusively breastfeed. So don't supplement with formula.
If you make enough milk and the baby is satisfied and the baby's making or gaining weight fine, then you don't need to supplement. If your milk production is not adequate, or a mom has to go back to work, or there's some other reason, then you can supplement with formula if you need to. But like we talked about, the optimal nutrition for the baby is breast milk. And if you can do that exclusively for 6 months, then that's what's best for the baby.
Okay.
If you could do it for a year, that's even better.
Okay. And if you want to supplement with formula, which formula do you recommend?
Any formula is fine. All the formulas are, FDA approved, and whatever. Even the store brand formulas are fine.
Really?
So yes. So there may be slightly different, but they're all approved, and you can use whatever you like. There's a bunch of different formulas, and sometimes there's formulas for like fussiness or gassiness, or babies who have spit outs and things like that. So sometimes we'll do that if there's babies who are having problems like that. But if you're just starting with supplement and you just want to try any formula, then any kind of Enfamil or Similac or Good Start, or any of those would be fine.
And I understand there's something called organic formula as well. Any thoughts on that, whether to go that route or the regular?
Or I'm not sure what exactly is an organic formula, but the most organic thing you can give your baby is breast milk.
Okay.
So if you're worried about being organic, then you should breastfeed your baby.
Great answer. Okay. What about thumb sucking?
Thumb sucking, well, babies, they suck their thumb or sometimes their hand, and that's normal for them to do that. They have a rooting reflex, and they'll put their hands in their mouth, and that's kind of a soothing behavior for them. So at this age, we're talking about newborns, and it's not really a big deal.
Okay.
Thumb sucking can be a problem later on, and like toddler age or 4 or 5-year-old kids.
Okay.
But at this point, thumb sucking is fine.
Okay. So newborn baby, when should the parents take this newborn baby to a pediatrician, at like when they're a week old or 2 weeks or 1 month? What's your recommendation?
After hospital discharge, they should be seen within 72 hours. So
within 72 hours.
2 or 3 days.
Okay.
And the reason for that is, one, we mentioned is a jaundice to make sure that they're not getting too jaundiced. And 2 is just to make sure that the weight gain is adequate. Babies typically in the first week of life, or the first few days of life, they lose weight, and then they gain it back in about a week or 2. So it's normal for them to lose weight, but if it's too much weight loss, and sometimes we actually do supplement with formula temporarily. So weight gain is another thing we're keeping a close eye on. And then, as you mentioned, parents have a lot of questions when they get home, things they didn't think about in the hospital, and that's an opportunity for you to ask your pediatrician those questions. Okay.
Another thing that scares new parents, besides the umbilical cord, is the sunken fontanelle at the top. So, in what instances should the parents, what should they look out for if there's a problem?
Well, a sunken fontanelle is a problem.
Okay.
It shouldn't be sunken. It should just be kind of normal.
Normal.
Yeah. Sunken means that they're getting dehydrated.
Okay.
And bulging can also be a problem because that could mean there's pressure on the brain.
Okay.
So it should just be normal.
Okay.
And, you don't... Touching it is okay. Sometimes parents are really afraid to touch it because it's soft, but you can touch the fontanelle. It's fine. Just don't press down on it hard.
So what is that? It's where the baby's skull is not...
Yeah, so the way the baby's skull develops, it's in plates, and they kind of fuse together with time over the course of the first year or so. And the fontanelle is just kind of those areas that are open where they're coming together. Okay. So that hole actually closes. There's actually one on the front and there's one in the back.
Okay.
The one in the back closes soon, within a couple months. And the one in the front that most people notice, that one usually closes typically by about 15 to 18 months.
Okay. Shave the child's head. And this, again, causes a lot of controversy. Should we, can we, and how?
Yes, you can. And I actually just did my daughter's, shaved her head just a few weeks ago. I think the way you want to do it is really up to the parent. If you want to take her to a barber or someone who's comfortable doing that, you can do that. I actually shave my baby's head with a razor.
Okay.
Yeah, very carefully. And it took me about an hour to do it.
Okay.
But I think as long as you're, taking proper precautions and you're comfortable doing that, then that's fine. Or you can use a trimmer if that's easier for you to do it.
Okay. But it definitely is something that can be done.
Yes. Right. Yes, okay. I did it for all my kids, and my patients do it.
So the whole theory behind it is that, you get a nicer hair growth and all that kind of stuff. Is there any merit to that theory?
Not that I know of. Okay. Yeah, I don't know of any research that supports that.
So, swaddling and layering, what should we dress our little newborn in?
Generally, what I recommend is that they should wear one extra layer from what you wear.
Okay.
Just to give them some extra warmth, because babies, they don't maintain their body heat as well as older kids or adults would. So I would, if you're wearing one layer, then you put 2 layers for the baby, and you can keep them swaddled in a blanket. And now they have sleep sacks also, which are fine for them to sleep in. You may have seen some of those in the hospital. A lot of hospitals are starting to use that.
Okay. All right. So, and cover the head, hat or no hat?
I would use a hat, especially those first couple months of life, because they can lose body heat through their head also. So a common question I get is, what should we keep a temperature at in the house? I have a lot of parents that ask me that for the baby. So I usually tell them that keep it whatever's comfortable for you. Keep it a comfortable temperature for you. Don't keep it extremely cold or extremely hot, but just put that extra layer on the baby, extra layer of clothing, blanket, hat, things like that. Okay.
And where should the baby sleep? Is it okay to have the baby sleep in a bassinet, one of those playpen kind of things in the beginning? Or should the baby sleep in the crib right away? And what are your thoughts on co-sleeping?
So bassinet or crib, either one is fine. Co-sleeping we don't recommend because of the risk of SIDS. SIDS is sudden infant death syndrome, and that's one of the risk factors. you may have heard your pediatrician telling you that you should always keep your baby on their back.
Mm-hmm.
And they
Back
tell you
to
that.
sleep, right?
Back to sleep, exactly. So that's been a campaign from the American Academy of Pediatrics since, I think it was 1992, where they encourage all babies to sleep on their back.
But babies don't sleep on their back. They turn to the side and they like to flop on their tummies. And
when they get older, yes. But in the beginning, if you keep them on their back, they'll stay on their back.
So do we use those wedges that you get in the market?
No. I would just keep them on their back, and you want like a firm surface. You don't want things like a waterbed or something like that, but a firm mattress, crib or bassinet, and you want them on their back.
Okay.
They found that babies who sleep on their stomachs or sides have increased risk of SIDS. And when they had this campaign and the research, this was a research study sponsored by the AAP, and they found over 50% decline in SIDS when babies started sleeping on their backs. So the other things you want to keep in mind is you want to keep like loose blankets, pillows, things like that don't need to be in a baby's sleeping area.
All those cute stuffed toys.
Yes, no stuffed animals, which is the reason why we don't like co-sleeping, because you don't want someone to roll on a baby. You don't want pillows and things to get on a baby's face and anything that could pose a suffocation risk. So they should be separate. You can have a bassinet or crib right next to your bed to facilitate breastfeeding, but they should sleep on their back and they should sleep in their own crib.
Okay.
And the risk of SIDS usually it's highest in the first about 6 months of life, which is incidentally when they start rolling and things like that by 4 to 6 months. So once they start rolling, you don't have to keep an eye on your baby and every time they roll over, put them on their back on their back. So it's most important the first few months of life. So you should keep them on their back. And then as they get older, you could put them on their back, but if they roll over, then that's okay.
Okay. And also circumcision care. What do we need to look out for and what do we need to do?
So if you have a circumcision, there's actually two major kinds of methods where circumcision is performed. And the care is going to be a little bit different for each one. So the first one is Placibel, and that's where they use a little plastic ring, and they put it on the end of the penis. They put the foreskin over it, and they tie it off with a string. And basically, the string tying it off makes that skin die off, and eventually the skin dies off. That's how the circumcision is performed, and that little plastic ring falls off. It usually takes about 5 to 7 days.
Okay.
So in that method, you don't need to do anything to it. You just keep an eye on it and make sure that the string is not coming out or it's not falling off too early or anything like that. But you're not supposed to put anything on it, because if you put anything on it, then it can slide off and affect the way the circumcision is performed.
Okay.
The other method is called the Gomco method, and that's where the doctor, it's sometimes done by pediatricians or it can be done by the OBGYN.
And it's done in the hospital before?
It's done in the hospital. Okay. Both of these are usually done in the hospital before the baby goes home, typically.
Okay.
So they use a clamp and they actually just physically cut off the foreskin with a scalpel. So in that method, the circumcision is done in the hospital right then. There's a little bit higher risk of bleeding and infection in that method, but there's nothing you have to go home with.
Okay.
And in that method, we usually recommend putting petroleum jelly or Vaseline over the tip of the penis for at least a week or two after the circumcision is performed, and that just helps the healing. And it keeps the end of the penis from sticking on the diaper and causing irritation and bleeding and things like that.
All right. And sometimes babies are born with these bluish, purplish marks, birth marks. Will they disappear or are they here to stay?
The most common birthmark we see is called Mongolian spots. And that is kind of a purplish, blackish spot that we typically see it's usually on the back or bottom. It can be on other areas too, but it's common in dark-skinned people, so you can see it in Indians or Hispanics. But those usually fade with time. It can take sometimes several years, depending on how dark and what the area is. But they're harmless, and they get better on their own.
Okay, very good to know. And the shape of the head, because with this Back to Sleep campaign, a lot of babies are developing flat heads. Will that resolve, or sometimes, do you have to put a helmet on the child? I mean, what should you do?
Yeah, so So you're right. So one of the side effects of that Back to Sleep campaign is having a lot of babies with flat heads. The medical term for that is called positional plagiocephaly.
Okay.
And they get flattening on the back of the head, and the vast majority of time, it just gets better on its own with time. Now, a couple of things that you can do to minimize that is by giving your baby tummy time. So we said we don't like babies sleeping on their tummies, but when they're awake, we like to have them on their tummies because it helps to improve their neck muscles and helps their development. So we recommend doing tummy time at least a few minutes a day, maybe 10, 15 minutes, 2 or 3 times a day, and increasing it as they get older. And you should be watching your baby at the time.
Okay.
So this helps them because they're not laying on their back when they're not sleeping. So that helps some. The other thing you can do is when they are sleeping is you can just turn them around, change their position. So they're not always on the same surface of their head all the time.
Okay.
So you can move like from one end of the crib to the other end of the crib. And so sometimes they favor one side or another, so that way they're not always on the same part of their head. So that helps also. But usually when the baby gets to about 6 months and they start pushing up, when they get a little bit older, they start sitting up and crawling and things like that. You're not going to see as much of that problem.
Okay.
The helmets is kind of a controversial thing because some people say that it helps. Some say there's no benefit to it. A lot of times insurance companies don't want to pay for it. So rarely do I have patients who need helmets. I've had a few where they've had severe plagiocephaly, where they've had a lot of molding there in their head, and they've had to wear helmets. But it's kind of like a last resort, and it's for like really severe cases.
Okay.
So the flattening is harmless. It gets better with time. But those couple things we mentioned can help kind of minimize it.
Okay.
Now, in the beginning, when babies are first born, they can have kind of weird shaped heads. And we call that molding.
Okay.
And that's usually just because, typically from the way they were in the uterus or passage through the birth canal. And sometimes parents see that and get really scared because they have this long, like alien looking head on the baby. So that it resolves after a few weeks.
Okay.
So
Good to know.
the baby's skulls are very malleable, and over the first few, you'll notice a difference even just the first few days live. And then by the time they're a few months old, it starts to improve.
Okay, great. Now, this baby is being, let's say, breastfed or formula fed. 2 questions. Should we put rice cereal for any reason in the formula? Like, what if the baby is spitting up a lot? And what does that mean, spitting up a lot? What is a lot? So what are your thoughts on these issues?
So the baby doesn't need water in the beginning, not the first few months of life.
First few months.
Yes.
Okay.
They don't need anything besides. We talked about exclusive breastfeeding, so that means exclusive breastfeeding. So no rice cereal, no water, nothing else.
Okay.
For those first 4 to 6 months of life. Water, the breast milk is like 88% water. So you get water from the breast milk. And if you're doing formula, then there's plenty of water in formula. So your baby doesn't need any water outside of what's in their breast milk or formula. Now, occasionally I'll use water in babies who are constipated just to give them a little bit of extra fluids, but I'm only giving them like half an ounce or an ounce. But I would talk to your pediatrician before you start doing that. But typically we don't recommend water. Excessive water intake in a newborn can actually be detrimental to the baby. It can cause electrolyte problems.
Okay.
So I've actually had a baby who, when I was doing my training, who had seizures because the baby was having diarrhea, and the parents kept giving the baby water to keep him hydrated. And in that situation, we recommend Pedialyte, not water. But that baby actually had seizures because they had low sodium.
Interesting. Okay, so you heard that, parents, no water, not necessary. And spit up, how much is too much?
Well, it's not so much the amount. It's the other things you want to look at, like is it affecting the baby's weight gain? So spit up, the medical term for that is reflux or gastroesophageal reflux disease. We call it GERD, which you see in adults also. So this is a common problem in babies. And all babies have a little bit of spit up, which is okay. Some babies spit up more than others. And as long as they're not fussy and they're eating okay and their weight gain is good, then there's nothing really you need to do about it. I usually recommend that after feedings that parents keep the baby upright for a few minutes to help minimize the spit ups and make sure they're burping well. So, but if they're acting really fussy, if they're having difficulty with the feeding or it's affecting their weight gain, and sometimes we use medicines for reflux, like Zantac, which you've probably heard about for adults. We use something similar for kids. We'll do that. Sometimes we'll do some formula changes, which may help if they're on formula and they're having a lot of spit ups.
Okay. Good to know. And colic generally starts about 6 weeks or so.
It can start as early as 2 weeks.
Oh,
and the latest is usually about 4 months.
Wow.
Yeah. So
4 months.
So if your baby is really fussy after 4 months, then it's probably not colic.
But what is colic? I mean, it's just like this very nebulous term. And
yes. Well, you're right. It is very nebulous. And colic just means the baby is fussy, and there's.
Is it at a particular time every day? Is that how do you diagnose colic?
Okay. So the definition of colic is unexplained fussiness for 3 hours a day, at least 3 times a week for at least 3 weeks.
So do you think adult men also suffer from colic?
I don't know. Maybe you can ask my wife about that.
Okay. So the magic gripe water.
Yeah. So gripe water is fine to use. There are gripe water that doesn't have alcohol in it. You just have to read the ingredients. So
does it work?
I don't know if there's any research on it, but I can just tell you just anecdotally from my own kids, I think it does help, and some of my patients' parents like to use it. So there's not, like we talked about before, there's not one magic solution for everything. So gripe water sometimes helps, especially if there's a lot of gassiness and fussiness. Sometimes Mylicon helps. Mylicon are just kind of infant gas drops that we use. So you can use that as well. And for some babies, one works, the other one doesn't work, or vice versa. So you just kind of have to try and see. So there's other things you can do, like using a baby swing or playing maybe some gentle or soft music for the baby. Sometimes taking a baby for a car ride. I've actually recommended that for babies who are very colicky. And I wouldn't do that when you're sleepy late at night, but sometimes putting them in the car and taking them for a little drive for a few minutes can help them calm down. One other thing is putting them on a dryer. Putting them in a car seat. Yeah, put them in a car seat and put them on a dryer. Don't leave them unattended, please, but make sure you're holding them there. And the vibration and the warmth from the dryer sometimes helps to put them to sleep.
Okay. Should the twins actually sleep in the same crib or no?
They should sleep separately. You can get a bassinet for them. That would be preferable.
Okay.
Sleep in separate areas.
Sleep in separate areas.
Yes.
Okay. Because I've heard different things like, they're used to being together, so they need to be in the same crib. And
No, they don't have to be in the same crib.
They don't.
But I think for just like we talked about SIDS, because for that reason, I think it would be better if they were sleeping separately.
Great point. Okay. What about giving, let's say, Tylenol to the kids? The little baby develops a fever, has a runny nose. Is it safe to give Tylenol to newborns?
Yes, it is safe to give Tylenol to a newborn. As long as you're following the directions on the box, we'll tell you how much to give. Ibuprofen, like infant Motrin or Advil, is not approved for use less than 6 months of age. So Tylenol is okay, but the main question though is, why is the baby having a fever? So the more concerning thing is if a baby has a fever less than 2 months of age, then you should not just give them Tylenol and not do anything about it. You should take them to see your doctor.
Okay.
Because less than 2 months of age, we treat fevers very seriously. We usually check blood cultures and urine cultures to see what was going on, because the baby's immune systems are not completely developed. They're prone to getting infections. They can't always express or communicate, when they're sick. So we routinely do a lot of cultures in babies less than 2 months if they have a fever. And a fever is 100.4 Fahrenheit taken rectally, or 38 degrees Celsius taken rectally.
Okay. When should you take the baby out for the first time? I mean, of course, taking them to the pediatrician is okay, but what do you recommend a newborn baby? When should they be taken out?
You can really take them out anytime, but the question is, where are you taking them out? So I usually recommend not going out to crowded public places the first couple months of life. because of the risk of infection, like we mentioned. So if you're around, if you go to like a shopping mall or a restaurant, there may be people who are ill or sick, and the baby can contract viruses and things for you where you just might get a cold. The baby may get a high fever and get really ill and end up in the hospital. That's the other thing is kids less than 2 months that have a fever, we usually hospitalize them for at least 2 days while we're doing these tests.
Okay.
So I tell my parents less than 2 months of age, if you don't have to go out to public places, then don't do it. If you don't have to fly, then don't do that. Now, if you're going to visit family members or you have family members coming to visit, I think that's okay. Just make sure that they're washing their hands before they handle the baby. And if someone is sick, that they not stay close to the baby.
How do you do that? Because that is such a touchy issue, especially if you have older kids, older siblings as well in the house, or what do? You just make it a routine that you tell people, wash your hands before you pick up the baby? I mean, here you have people just coming right in from outside and, oh, how cute, and they pick up the baby and, disaster.
Yeah, you just have to be honest and be upfront about it. Say, you mind please washing your hands before you hold the baby? One thing that I do that I found is easier is just using some hand sanitizer and just keep it close to the baby's crib or wherever. And that's a lot of times easier for people to do that, to quickly just use some sanitizer and clean their hands as opposed to having to go wash your hands and come back. So I find that makes it a little bit easier for them, and it's a little bit easier for people to do that.
Okay, wonderful. Vitamins. Do we have to give vitamins to newborns or no?
So if you're exclusively breastfeeding, then we recommend taking vitamin D drops because there's not much vitamin D in breast milk.
Okay. So give it to the baby.
Yes, give it to the baby.
Okay.
Yeah, you can buy vitamin D over the counter, and the dose is 400. It'll say IU or international units, and that's usually 1 ml daily.
Okay.
So babies who are exclusively breastfed should take vitamin D. You can start that pretty soon within the first week or two of life.
Okay, good to know that. What about things like diaper rash? That's a big one. When do you take the baby to the pediatrician, and what do you put? What do you recommend that the moms use at home?
So there's a lot of creams that you can get over the counter, Destin, A&D, Bag Balm. There's a whole slew of them that you can find in the stores. And most of them work pretty well. The main thing is that you want to do it frequently, and you want to create a barrier with the cream so the moisture is not getting there and irritating the skin.
So should you use it just with every diaper change?
You can do it with every diaper change, yes.
Okay.
Yeah, you can do it with every diaper change. And
just prophylactically? Or no?
Oh,
only
I mean, if they have a diaper rash.
If they have a diaper rash.
But you don't have to do it with every diaper change. I mean, if you want to do it here and there, you can, but I think it'll be kind of tedious if you're doing it with every single diaper change, especially if they're making 12 diapers a day. So if they're starting to get a little red or, starting to get a rash, then you can start using that. Now, I like things that are thicker, like Aquaphor is one, or Vaseline, and they stay on better and create a barrier on the skin. So typically, the moisture from like urine or stool that can cause some irritation of the skin and cause some skin breakdown.
Okay.
So you want to create a barrier there to protect the skin and help it to heal.
Excellent.
And you can also leave the diaper off for a few minutes, and that helps it to air dry and keep it from having that moisture there on the skin.
Okay. Excellent.